Hemophilia A is a genetic disorder which possesses long-term impacts on patients. Hemophilic patients usually face physical, psychosocial, and socio-economic impacts, which greatly affect their quality of life. Physical impact is the most serious long-term one, which includes hemorrhagiopathy, blood-borne viral infections, venous scarring, reduced life expectancy. Hemorrhagiopathy is a condition characterized by repetitive hemosrosis and ultimately joint deformation. Patients with hemorrhagiopathy suffers from severe pain, swelling, and limited mobility, and joint replacement may be necessary. According to the Cost of Hemophilia Across Europe Socioeconomic Survey, CHESS, chronic pain scores are reported that 205 hemophilic patients suffered from mild pain, while 19 hemophilic patients suffered from severe pain. Hemophilia A has a long-term impact on hemophilic patients, which differs based on patient's age. Parents should balance between vigilance and overprotectiveness when they deal with their hemophilic infant or toddler. Early childhood patients may suffer from socialization barriers. The psychosocial impact also affects pre-adolescents and adolescents, adult and older age. Moreover, when we come to socioeconomic impact, hemophilia A can be a burden on patients in the terms of required lifelong treatment funding and high drug costs, non-drug costs as work lost and caregiver burden, development of inhibitor and/or comorbidities. Current standard care is of hemophilia A is the treatment of purified factor VIII, which may lead to the development of factor VIII inhibitors, which can occur in 25 to 30% of patients with severe disease. Patients with factor VIII inhibitors are still vulnerable to a significant number of bleeds, despite treatment with the recommended doses of either on-demand or prophylactic bypassing agent therapy. In addition, patients with hemophilia A with inhibitors have unmet needs with the bypassing agents like all bypassing agents are administered IV. Half-lives are short, meaning the frequent administration is required. Do not offer consistent protection. When compared to on-demand treatment, prophylaxis treatment significantly reduced all types of bleeding over a 1-year period. Immune tolerance induction treatment can be a burden on patients in terms of it is intensive with infusions every 1 to 2 days, is only successful in 70% of hemophilia A patients, high cost average of €60,000 per patient per month, as current prophylaxis requires more frequent administration from 2 to 3 times would result in higher trough levels, but costly and inconvenient. A non-interventional, prospective long-term cohort study showed that, over 3 years, approximately 50% of people with severe or moderate hemophilia A treated with prophylactic factor VIII had an annual bleeding rate of greater than or equal to 2. All currently licensed hemophilia treatments are given by IV infusion, so that patients with hemophilia A either have to attend a HCP or healthcare professional with the burden of several limitations: veins damage, limited sites for injections, risk of bleeding and infections. In contrast to SC injections, which are generally well accepted by patients and of better adherence as it is quicker and easier administration than IV infusions, generally requires less equipment than IV infusions.